subscribe button. Some of y'all know Dr. White, some don't, but Dr. White is one of our 3 bariatric surgeons here in the office. He started with us, a year and a half ago?
Yeah, last July, last summer.
He came in the shoes following Dr. Strickland, so he started here in high school, went on to medical school to MUSC, right?
Yeah.
And then did his residency, part of it, at Virginia.
Residency at MUSC and fellowship at UVA.
Yeah.
That's right.
So we're glad he's here. A lot of us like about Dr. White is his down-to-earthness and approach. He's so approachable. So
I get myself in trouble a lot of times, unfortunately. It's a blessing and a curse. Yeah.
We're glad that he's on our team, and glad y'all are here to see him tonight and talk about motivation, which we all struggle with, right? So
the floor is mine?
Yes.
All right, I'm going to switch seats, but I hope y'all forgive me if I sit down. I'd rather keep this casual. Yeah, thank you, Brandon. Like Brandon said, I actually was an ER tech at Lexington Medical Center in high school. I was like 17 years old, putting in Foley catheters and putting in IVs and stuff back before there were a lot of like rules about what you could and couldn't do. So that was like how I got my start in medicine. I knew both of Dr. Strickland's sons. I worked with Ben Strickland, who as in the ER, like when we were both children. So I've known Ben for a long, long time. And then David, Strickland's other son, was in my med school class. So I got hooked up with Dr. Strickland towards the end of residency. He was good friends with one of my teachers at MUSC. Luck brought us back this way. Like I was in Virginia for a year. And then worked in Myrtle Beach for a couple of years doing bariatrics at Conway before I came here. But happy to be home, happy to be here. This is a phenomenal practice. The history of what Dr. Strickland and Dr. Givens built here is remarkable. I mean, thousands and thousands of people have had surgery, changed their lives with the bariatric program here. I didn't know what to talk about tonight until about 2 weeks ago. I was in my clinic and I met a patient who Dr. Strickland operated on in 2001. So this patient was almost 25 years, give or take, removed from her surgery. I always marvel when I meet people who are 20, 30, 40 years removed from their operations. Usually when I'm meeting people that are that far out from surgery, it's never for good things, like usually it's in the emergency room or like I'm doing something that's gone haywire and I'm having to meet them for some complication. But I always ask everyone the same question. And the question I always ask is, if you could go back in time, if you could turn back the hands of time, would you do this again? And I bet I've met 40, 50 people now at this point that are kind of that far removed from surgery, and universally the answer I get is yes. Now maybe they're just sugarcoating it, being sweet to me or whatever, but even in the context of people having complications, they always tell me, absolutely, I would do this again. This patient's story was, I think, especially remarkable. She lost a tremendous amount of weight after her surgery, like somewhere on the order of like 150 pounds. And then over the years, like by the mid-2010s, she was back in her office and had regained almost every single pound that she lost. And then she got plugged back in with us and lost it all again. I mean, she was back down almost 100% of her excess body weight. So the course of time between her operation and now, almost a quarter of a century, she lost all of her weight, regained it, and then lost it all again. And I think what I took away from that is that even if you slip up, even if your motivation wanes, even if you gain weight, even if you get back to where you were before, you still have the tool and you have the power in your hands to take control, to end up wherever you want to be. I think a lot of times a lot of patients that I meet, to make it more personal, are kind of fatalistic about their weight and about their health. It's, the pounds just come on, or I started on this medicine, I gained a bunch of weight. They feel like or what I hear is that people think that it's out of their hands or out of their control. And no matter whether you're, taking control and losing the weight and taking control of your health by, doing it your own, going on a diet and exercising, or talking to your doctor, going on a plan, or taking medications or injecting yourself with whatever, or having surgery, no matter what method people use, this stuff works if you want it to work and if you work for it and earn it. there's absolutely nothing that can stop you from hitting your goals if you've got the willpower and the motivation to do it. The surgery, it feels like the culmination of something, because I think of how long it takes to get from meeting us to having your surgery date. Like a lot of people wait 6 months or longer, and it feels like an eternity. Like the first time I meet people in the office, they want surgery the next day. They don't want it tomorrow. They want it right now. And because this is the way of the world, because insurance rules the world of what we do, people have to wait. And so surgery feels like the culmination, like the end of like a process. But really the surgery is now especially it's 30 minutes of your day, like one day out of the rest of your life. And surgery is not the end of anything. It's just the beginning of people's journey, And so no matter where your journey takes you, no matter if you slip up and gain weight back or where you end up, you've always got the ability. It's in your hands. The power is there. You've got the tool to end up wherever you want to be, to end up however, meet whatever goal you're trying to get to. Not trying to give like a motivational speech or anything, but that was one of the really super interesting and touching things that I've experienced in the last couple of months here. I don't know. Do y'all have any thoughts about that? About you've always got the ability within yourself to kind of meet whatever goals you want to get to, and nothing. There's a lot of excuses, and life gets in the way. But if you're focused, if you're motivated, if you're determined, you can always get to where you want to get to.
And doesn't the research show? Remember that study? I think it was like about 15 years ago. I'm so old, I can't remember when exactly it was. But it was many years ago that they studied that long longitudinal study about even if you gain back weight, your longevity and your comorbidities really were much lower than not having surgery.
I think that's definitely one of the miraculous things about surgery is that, these operations help you lose weight, but they have innumerable benefits besides just weight loss. And like you said, even if people do regain after surgery, very few people ever get back to like what they were before. But then you still see the reductions in mortality, all-cause mortality over time. Most people, even if their weight creeps back up, they stay off the medications that they came off of and stuff. So there definitely are like different. That's some of the unique and distinct things that distinguish like surgery from medical weight loss. I mean, we have mountains of evidence now about long-term outcomes from bariatric surgery, and it's definitely about more than just your weight, But that's the thing that shows up on billboards, right? It's losing weight. That's how people get sent to us. It's weight loss surgery is what everyone calls it. Our operations are definitely about more than that. But I think no matter where your journey, your life takes you after surgery, even if it's 20 years later, there's nothing that can stop you from getting to where you want to end up at.
We talked, building off of that, I think so many times we hear with patients is changing that mindset, like you said, from all or nothing. It's we talk about resetting a lot. Like life is going to happen and stressful events are going to happen, but pushing that restart button of let me get myself back in check and not throwing in the towel altogether. Of we are human. We're going to make mistakes. We're going to have rough periods in our lives, but not throwing it all in.
I think that's definitely a great point. Oh yeah. I think one of the things that I think helps people the best long term, the people who have the most success long term, are the ones who take the honeymoon period right after surgery and use that time to really change your lifestyle, right? Change behaviors around food, behaviors around activity. The first 6 months, the first year after surgery is the easy time. It's when you're going to lose weight whether you want to or not for a long time after that. But taking advantage of that time early on to really like gain an understanding of what it takes to lose the weight, right? What it takes to feel better, what it takes to have the medicine, the pill bottle shrinking instead of growing. That's I think one of the things we try to coach people up is after their operations, in the first couple of years or so, is making those lifestyle changes, right? It's so that when you do have life events happen, it's not falling back on old habits that kind of got you where you were in the first place.
That's good. What do y'all think about that? Some of you that are further out. Do you fear that? Do you feel confident? Do you...
Are there any specific questions for Dr. White about how that would look or feel or what I struggle with that maybe he can answer?
Maybe the cholesterol. If, like myself, I can't take cholesterol medicine, even though they try this, try that, try that.
Yeah.
The newest thing now is for the Repatha. And I'm kind of like, I don't want a shot because it's in me. You know, whereas a pill, I'll be like, okay, I'm having a side effect.
Yeah.
I can stop. But a shot is like, you done gave me the shot. Now I just have to, you know, deal with the side effects and whatever. But losing weight, you know, through bariatric surgery, as far as with my cholesterol, just naturally go down.
So cholesterol is one of the more frustrating comorbidities for me. Like, you know, I can almost reliably predict when people are on several pills for their high blood pressure. I can look at them in the eyes and say, you're going to come off those medicines,
Yeah,
you know,
I'm
within
gonna
6 months, a year after surgery. Cholesterol is really quite frustrating and stubborn, though. It's very slow to come down. Our body's cholesterol metabolism and like where it maintains the levels has a lot to do with like your intrinsic liver function. And we know that these operations change the way your liver uses lipids, uses fats and stuff. But sometimes it's one of those lagging things. Like it can take years before people see like, you know, dramatic enough reductions in their cholesterol to come off their statins, you know. I don't know enough about an injection for cholesterol to give you you know, an intelligent comment about that. I mean, everyone wants to get off all their medicines right all the time. The statins are one of those stubborn ones that always lags, you know. But I think when the magic number in terms of like the most improvement in people's medical comorbidities tends to be around like 10 to 15% total body weight loss. Usually when you start getting to that number, that's when some of those more stubborn things start to come back down. I don't know. So part of me thinks that statins are like magic happy medicine, right? Like everybody should probably be on one of those. They have these like magical anti-inflammatory properties. So if you gotta have one pill to be on, that's probably not a terrible one to take, unless it gives you the cramps and stuff like that in the legs and stuff like some people. I don't know. There's other strategies like with diets to try to drop cholesterol. You know, changing like what kind of fats you eat and stuff like. But yeah, the high cholesterol is a really stubborn problem a lot of times for people.
Really affects triglycerides though, right?
Oh, yeah.
When you lose weight. That's an element that goes into your total cholesterol.
Yeah.
Yeah, because you think about the protein and then you think about the meats and that's cholesterol. So it's kind of like you're going to have to eat a lot of beans or, you know, be vegetarian.
Other ways to find
Yes,
protein.
to find the protein. And then, yeah, because I tried, I said, okay, I'm going to try it again. And I
Yeah.
was like 2 milligrams, like made my muscles in my legs hurt so bad where I'm like, I can't.
Probably just not best for you. I mean, the cholesterol that's one component of like cardiovascular health and cardiovascular disease too, but it's definitely not the whole picture.
Yeah.
So I think that
I'm on that too.
the overall like reduction in people's cardiovascular risk of having heart attacks, having strokes is so tremendous after surgery. Even I think even if you still have to, you know, if your cholesterol levels are still hanging high, like it's getting the blood pressure down. It's getting a lot of times for people, it's improvement in your the resistance, the blood flow through your lungs, the disease that gives you sleep apnea or the result of sleep apnea, as that improves, as your lung function circulation gets better, that takes so much pressure and stress off your heart too. I think the overall, like, I mean, the improvement in people's cardiovascular health after this is tremendous, even if you're still struggling with cholesterol.
Okay.
So does the surgery, it does help with sleep apnea?
Absolutely.
Yeah.
The last I saw, I think the rates of resolution for sleep apnea is somewhere on the order of like 70 to 80%, which is phenomenal. Sometimes you can just sort of look at people when you're meeting them the first time and predict that they're going to have sleep apnea, you know. And when you start losing a lot of the weight, a lot of times one of the first places you notice people's weight loss is like in the face and in the neck and all that, and that's where all that apnea comes from, is like congestion of the upper airways, usually for most people. Some people have like central sleep apnea, but yeah, people see tremendous improvement in sleep apnea. the surgery book that I read says that you need to stay on your CPAP for about a year after surgery. But ask me how many of my patients stay on it for a year, it's about 0%.
Right.
I mean, almost within a matter of a month or two, most people can tell that they're sleeping so much better, and they're not getting the afternoon tiredness, the yawning at 2 o'clock. That's one of those cardinal symptoms of sleep apnea. And almost everybody will take themselves off of it at some point.
And then that we know sleep improves everything else, right?
Yes.
So
Oh, yeah.
everything with sleep
Mental
that
health, oh my
follows
gosh,
is lower improvement in mood, decrease in
Right.
depression, anxiety, which we know that sometimes sleep disorders, mental health, they almost go hand in hand.
Yeah.
So it just trickles. Everything that the surgery improves on it, it can really improve mental health wise too. So, which is really neat about that too.
But for me, it's been December, will be like 5 years.
Yeah.
And unfortunately, still on the blood pressure medicine. I look at my medicine that I'm taking, and I'm thinking like, I thought I was going to be off all this stuff right here. So, you know, I keep wondering, well, for me, it was a lot of issues with mine.
Yeah.
So, is there any chance I'll ever get off all that medicine? Different stuff?
I don't know. I wish I could tell you. And you know, when people don't get what they're looking for, it's incredibly frustrating. It
Right.
feels like you know, it feels like a loss, right? You know, if people don't get everything that they're after with the surgery, you know, and it's hard to explain why some people do and some people don't. There's a lot of causes of high blood pressure that aren't related to people's metabolism and weight, you know, that are difficult to diagnose, difficult to point out.
Right.
Some of those things make it more challenging for people for their blood pressure to improve afterwards. I mean, people have what's called essential hypertension or essential high blood pressure. That almost always gets better. People see some improvement, if not outright resolution. But there are a lot of other causes of high blood pressure that may not necessarily be related to people's weight that sometimes people don't see, you know,
Right.
that dramatic drop in. So I don't know. It could be something along those lines. Hard to say. I mean, yeah,
Right. Because I got rid of the sleep apnea,
yeah,
threw it away. The asthma, I don't have a problem with that. Even though the doctor said keep the rescue inhaler.
keep it for when you need it, sure.
Yeah, but I don't think I need it, but he said keep it, so I keep it. And, you know, little different things like that.
Yeah.
I got better from
Yeah,
those.
I mean, and everybody's outcome is so different too, and it's
Yeah.
challenging to predict, like, you know, what's going to happen 6 months, 1 year, 5 years down the road. You know, I think a lot of it kind of depends on which operation you have too. Some of those things make differences, like in those kind of outcomes.
I had the hiatal hernia repair
Yeah.
and the what one did I have?
Had a sleeve.
Sleeve, yeah.
Yeah.
Sleeve. A big one.
So much of people's like medical comorbidity improvement has to do with how long they've been diagnosed with those problems too. We know for 100% certain that the earlier we get to people, the better people do. This I think most notable with diabetes. If people have been taking insulin for years and years, it's a real challenge to get off that insulin afterwards. But if we get to people who, you know, their A1C is just starting to creep up and they're on metformin or they're on a couple other medicines, it's way easier to get their diabetes cured with the surgery. So much of it has to do with kind of the time frame that we're dealing with people too.
Right.
Yeah, what's up?
I do my last class Monday, and then when I had the gastroenterologist thing done, they was saying about my liver.
Yeah.
They may have. He said somebody wanted to take a sample or what. Is that like everybody has to do it, or is that just?
I think that's kind of surgeon dependent. Some of it has to do with kind of what you see in the operating room too. I mean, everybody that we operate on, that we're doing weight loss surgery on, has got fatty liver disease. 100% of people do. The degree of which, you know, I think some of that factors into the surgeon's decision about whether or not to take a biopsy. We're talking about taking, you know, a piece of it that big and sending it to the lab. It can help. it can help identify if people are in the early stages of fibrosis or of like scarring of the liver from fatty liver disease. I wouldn't take it as something to, to be afraid of or worry about. I wouldn't lose sleep over it. It's one of those things that I know Dr. Strickland did on everybody. I don't biopsy a single liver, I think a lot of this is just kind of surgeon preference, how we're trained, what kind of stuff we look for, and it can be useful if people have if we know you have liver disease going into it, we can kind of grade it, and that information can be useful for people's GI doctors. Like if you have a liver doctor, that kind of thing, it can be helpful to have that information. We almost always see marked improvement in fatty liver disease after the surgery. So I don't take what happens at the time of surgery is necessarily anything. It doesn't help me take care of people later on, but it can be useful information in certain contexts. I wouldn't sweat that though.
Yeah.
It's it's going to add 30 seconds on your operation.
Yeah.
It's a quick little thing that I think Dr. Antonetti and sometimes Dr. Hughes do.
What about mood swings? Have you noticed, if anybody ever, their mood changes drastically from the time that they have it? Because I suffer from anxiety really, really bad.
Yeah.
And I feel like it's gotten a little worse after surgery. I don't know, our bodies are flooded with hormones and stuff like that, but it's a little hard for me to function day to day
Yeah.
with stress.
I don't know. You could probably tell me a lot better than I can tell you about that. Usually when I'm seeing people, they're in a good mood, happy to see each other. Not always, but the day-to-day stuff, those are the things. The lived experiences. I don't get to see that. I don't get to be around that all the time. Brandon, do you have any thoughts about that? About kind of?
Yeah, I do. And we know that each stage is different after surgery. We know initially there's a lot of hormonal changes. It can be related to that. But also just different life phases too. I know people don't like that answer, but life, there's so many different life phases. So when I'm dealing with a patient that's 18 years old and coming in for weight loss surgery, I'm really having to identify their maturity level and what is their world, what is bothering them in their small world. It's not quite as wide as everyone else's yet. So I think each life phase can add on additional stressors, which can lead to increased anxiety. But it can, depending on what age you get the surgery, it can affect it differently. So I know in the medical and mental health field, we have to look at each person individually. So not only in my perspective, but Dr. White's too. So a lot of times he's it depends on the certain patient in the certain case, but it really does. There's so many factors that go into medical and then mental health too, but yes, you can, let me ram it back in, but mood swings, it can be prevalent for a number of different reasons, but very rarely it's related to surgery. Maybe initially that kind of hormonal imbalance of things, the first few months, maybe 6 months, we see some irritability, and that's related to being restricted in diet. And then also,
I can tell you about a third of people have an absolute mental breakdown about 1 month after surgery.
It took me 5 days.
There you go. Yeah.
And my family was eating pizza in front of me, and I went and got in the shower, and I cried to the water running cold.
Yeah.
Because I couldn't.
It's the, oh my
Day
gosh, what
five.
did I do?
What have I done to
I do?
myself? Yeah, exactly.
Yeah.
I think if you don't really know what's coming, I think it hits people like a ton of bricks afterwards.
People say it's the easy way out, but it's the hardest thing.
I'm sure
Mentally, it's not
overwhelming
for the
too.
weak. I'm just gonna. You have to be strong.
I mean, everyone who comes through my office knows. I tell everyone this is not magic. There is no sorcery involved in surgery. Every pound that you lose, you earn.
I'll never forget when I told you about that. You're like, well, there's probably going to be a couple more times that's going to happen.
It's gonna keep happening. You gotta move past that. This is who you are now. This is how you eat now. And but don't take that as a down or as a negative, right? I mean, I think at the end of the day, usually when people see a lot of success with losing weight and they see who they think they feel like in the mirror in front of them and stuff, I usually see a ton of improvement in people's mental health. Like, people are just happier, happier with themselves and just thrilled with what they've done, the work, what they've earned. And I love seeing that. I tell everyone that I wish that they could see themselves 6 months after the surgery, because if they could, nobody would have any reservations about doing this kind of thing. It gives people the chance to have the life that they want, that they feel like they should have.
And I think too, going back to what you said about it's a lifestyle change. Part of those beginning stages and months, you're trying to get your lifestyle where you want it to maintain your weight loss. Because I know there's a lot of you, several of you in here that are anticipating surgery, and that's a struggle to change big things in your lifestyle, to get active and to really change the kinds of food you're eating and preparing, and maybe not eating out all the time or eating fast foods. And, once your lifestyle changes to where, you really want it, I think people settle down emotionally a little bit. Would you agree, Sarah? You're shaking your head.
Yeah, for sure.
What would you say about all that? Because your lifestyle has changed and it's remained.
Yeah, I think it was really hard. Losing the weight wasn't hard at first, but it was kind of hard to find like your new lifestyle, and everything was just really different. Like when you went out to eat with people, and even like eating lunch at work and stuff like that was just like really different.
Just your day-to-day demands time. Time and effort, like talking about preparing your meals at home, cooking at home 6 nights a week, when a lot of people don't do that kind of thing beforehand. It requires effort and energy and time, but it's so worth it. And I think that the change is forced upon people, but I think ultimately if you stick with it and if you do it right, it becomes a new habit. It just becomes kind of the way that you are afterwards.
I compare it a lot to having a baby. You can mentally prepare.
That's very true.
Talk to my patients about this. If you have children, you can mentally prepare for that baby for 9 months, right? And same thing with weight loss surgery. You can mentally prepare, and then when you have it and the baby's here, is like, what the heck did I do? My whole life has changed. I can't just walk out of the house and go out to eat, and I have this something with me now that I have to. So I try to remind patients, look at this as a new normal. You have to adapt and change, and it is different, but you'll get there. But repeat yourself. This is my new normal. And it doesn't mean it's not hard, but it's very similar, that adjustment period of having a child. Kind of like, what did I do? You go through phases of like, what did I do? What is this? Shock, and then a little bit of blues, and then it's like, okay, I can do this, and so, but very similar.
Speaking of being like a child, there's actually a running joke with me and my husband. Anytime we go somewhere, like long distance or for the weekend, I tell him I have to pack my diaper bag, which means I carry. He can stop at the store and go in and get whatever he wants. But we all know a lot of convenience stores do not have something that's good for us. So I have a ice chest just for snacks.
That's perfect.
So
perfect.
I always say, let me get my diaper bag. So it's almost literally I have to pack it every time I go somewhere because I refuse.
You don't want to eat food out of packages. Yeah,
I
exactly.
refuse.
But for me, for a few months, I couldn't stay by myself because I had a TPN thing.
Oh, okay.
But when my sister-in-law, who had the surgery, she told me, she said, when you go to the grocery store, get your stuff. When you go home, prep yourself.
Portion it out and prep it out. Yep.
Prep it. Cook several different kinds of meat in the oven. You do your veggies, mix them, and then she told me, said, get your containers, small containers, put them in your stuff in the containers, put them in the freezer.
Yeah.
To this day, my freezer got stuff in it that's already cooked and prepared.
That's
I don't
perfect.
have to cook every day if I don't want to.
Doing it one day a week, like making like a Sunday your prep day, that kind of thing. I think it's a great habit to get into.
Yeah.
Yeah.
I don't think that, I feel better from my weight loss. I have more energy, but I don't think it changes the stressors that I have on a day-to-day in my life. I think
Yeah.
that the energy that I have gives me the ability to be able to handle with things maybe a little bit easier, but doesn't change the stress at work. It doesn't
Yeah.
change the stress.
Life
with
is gonna
kids.
keep
It doesn't
happening.
change-
Yep.
It doesn't change any of that. So you still have to have tools to be able to deal with those day-to-day stressors, even if you're feeling good, and when you look in the mirror, you're 5 sizes smaller. You still have to be able to deal with those stressors.
Yeah.
It doesn't change that,
Yeah.
unless you want to live in a cave, like my husband could with books. But, unless you.
Finding new ways to deal with that stress and those
Absolutely.
pressures of life, other than going back to food as a source of
to
comfort.
food, that's right.
Mhm.
So, I think that it doesn't change. If I went into surgery thinking that all was going to change, that would have been disastrous, because
Yeah.
it doesn't. Life still happens.
Life goes on. That's right.
Share with us what you're doing with, I know you're doing some different things of how you're managing your stress, because she's also,
Yeah, go ahead.
a social worker as well.
Yeah,
So
I'm
she
an independent
deals,
social worker.
uh,
I have increased my reading.
Hmm.
When I go to work, I have something to do. If I have downtime or something, I'm always doing crosswords. I'm doing word searches. I'm keeping my mind busy, because it's when I don't have something to do that I'm thinking about the vending machine.
Yeah.
I take my lunch to work. I very seldom go out, and if I go out, I'm very choosy. Boy, will I hand in that child card, this patient has had surgery, please let them. I don't have a problem playing that card. But I use a lot of mindfulness to try to help me make sure that I am right and thinking right, and I'm
Yeah.
taking care of myself, and meditation, because nothing else in my life changed except my size. My husband's still my husband, my kids are still my kids, my job's still my job. The car still needs tires.
Yeah.
I mean,
Yep.
it's, you just
The
have-
bills still come. That's right.
It all still comes,
Yep.
but I think that the energy level I have gives me the ability to deal with it a little bit better, because I can go out and take a walk around the building or the complex without taking 15 steps and not being able to breathe anymore. So there's a lot of things that you can do to help with, because I have anxiety too, and I still have PRN meds for anxiety, because work still happens. When we had the hurricane, both houses on the property were hit with trees. My first thought was, I need candy. And I'm, a year and several months out, but my brain still is going to that place of
Yeah.
self-soothing with something different. I think that it's going to be something that you work with and work on the rest of my life. I'm going to be doing this, and it's worth it, because I feel so much better.
Yeah. Finding that coping mechanism, whatever it's going to be,
Yeah.
finding something different,
Yeah.
something other than what you used to fall back on.
That's
you know,
right.
for a lot of people, it's exercise, physical activity. I mean, going for a walk or doing some exercise in the gym, it literally gives you dopamine. It gives you happy hormones. And what better way to feel good than that? Getting comfortable with the idea of making your body uncomfortable is a hard first step to get over a lot of times too.
One thing that I wanted to add, being in therapy prior to surgery and after therapy, or after surgery, has been key for me. Actually, the reason why I decided to have surgery is because of the therapy I received, where I was doing so much healing and inner work. I looked on the outside and went, I don't match. Who I am internally does not match my physical body. And then after surgery, having the continuous support. And when the crap hit the fan, I still had the continuous support and accountability that was absolutely priceless. Another thing I did is I found a personal trainer who is a licensed social worker and a trainer on the side.
There you go.
He's phenomenal. And will call me out on my thinking and doing the therapy thing in the middle of squats. So I just feel really blessed by this experience. I feel very blessed by having an amazing therapist. And I'm a therapist too, and believe that therapists need therapists. So as long as I'm practicing, I'll remain in therapy. But just wanted to say that.
Yeah, it's good.
Well, I think one of the bigger motivations for me is I've taken my grandkids to the beach. I would have never, ever taken them to the beach. They're 8 and 10 and 18, but I mean, out on the beach with them, doing things with them, I would have never been able to do that.
Yeah.
It's great.
Yeah, kind of bringing it back to where we started. You know, whatever that motivation is, whatever brought you in the door the first time to come in and talk to us, you know, holding on to whatever you know made you summon the courage to decide that like it's time to do something about this. Hold on to that and remember what that is, because that's such a strong drive to even start this process that I think keeping that in the forefront of your mind, even years later, is so critical for people.
I love that.
Do you look at the other organs when you go in to do the surgery?
I mean, yeah, mostly just like a glancing look,
Yeah.
unless there's something really outright, you know, odd looking. But we're by and large, you know, we're there to do a job and kind of focused on the task at hand.
Yeah, I mean, you know
Yeah.
what I'm saying, you know, to make sure that
I
like
mean,
your gallbladder, your pancreas, do you look at? That's
I don't go looking for trouble. So one of the things too is like you can't
I want to
look,
make sure everything's okay.
but you can't look at a gallbladder and know that there's something wrong with it.
Yeah.
You know?
Yeah.
You can't look at a pancreas and know that there's something wrong,
Yeah,
right?
okay.
Outside of like extremes, you know, like
Okay.
there's just usually not a whole lot that just catching a look at it, a peek at it,
Yeah.
really tells you. The more you touch, the more stuff you do other than the task at hand, I think you increase the likelihood of causing some problem or causing something, you know, to go sideways. In surgery in the operating room, 1,000 things have to go right and 0 things can go wrong, you know. So the more you do, every second you're there longer than you have to,
Right.
you increase the likelihood of complications. So for me, it's get in, do the job, and get out. You know, I'm not going looking for problems
Okay.
unless I've got something I know about going into.
Okay.
You know.
Can you talk about how long it takes you to do the sleeve and then the bypass?
Yeah. So I can actually tell you exactly. So I do all my operations with the robot, and I have since I left residency. The Da Vinci robot is really awesome. They track all of our data. They know not just like to the minute how long each instrument is in use. The robot tracks the movement of the surgeon's hands in space. So like the intuitive people, they can tell you the difference between an efficient and inefficient surgeon based on how much you move your fingers in surgery, you know. But outside of the crazy stuff, it keeps track of our time. So my like average for sleeves, let me tell you the last one I did. Hopefully not have to go too far back in time. Somewhere around, so the last one I did was 24 minutes on the console. There's always about 4 or 5 minutes of getting access, so making incisions, putting the ports in, hooking the robot to the ports, and then I get to take off my gown and go sit down.
So scary for you saying that.
What is?
You are joking, right?
I'm gonna hook up the ports and go sit down. I'm
Yeah.
sorry. That to my age person is like very scary.
It's also miraculous too. The control, the precision of the robot. The difference between. I'm going to get off on a tangent about robotic surgery here now. In the early 1990s, a transition in surgery happened between open to laparoscopic surgery, and it completely revolutionized surgery. Not just in what I do in general surgery, but basically every field where patients go to the operating room. The saying was that minimally invasive surgery transfers the pain from the patient to the surgeon, and that truly is the case, especially doing like laparoscopic bariatric surgery. dealing with big bodies and a lot of forces and stuff. The robot takes all of that pressure off of the surgeon's wrists and hands and elbows and puts it onto a machine. So the robot is going to extend my career longer than Dr. Strickland's because it's not going to break my body. I think Dr. Strickland had multiple neck surgeries. I think he had wrist and elbow operations. My mentor in Charleston had tennis elbow in both of his elbows. That's one of the awesome things about the robot is that it will extend surgeons' careers. So my sleeve average time is 32 minutes. Half an hour, to do this operation that completely transforms people's lives.
And the bypass one?
Bypass is around like 70 minutes, about an hour and some change. A little bit longer. There's just more steps in the gastric bypass. Everyone, they have this concept that the bypass is more invasive than the sleeve. Technically not exactly true because I use the exact same port setup, the same number of incisions, the same exact, setup. We position the patient the same and all that. There's just more steps, changes in the anatomy in the gastric bypass. That's what takes it a little bit longer. But still, we're talking about, 30 minutes or 60, 75 minutes out of your day, out of one day for your entire life. Everyone stays one night in the hospital, down from there. It wasn't that long ago. Everybody stayed 2, 3, 4 nights in the hospital. We're down to just keeping you overnight, and that's probably 95% of the time people are out by the next morning. So, I see sleeves especially as not much different than getting your gallbladder taken out, and people don't think twice about that operation as far as like the level of risk, perioperative risk, complication rates and stuff. It's safer than gallbladder surgery, but these operations are.
My recovery was a lot easier than gallbladder surgery.
Is that right?
Yeah, tremendously.
Yeah, I think that some of that has to do with the robot. Some of it is everybody takes surgery a little differently too. Everyone kind of takes pain and handles pain and discomfort a little differently. But by and large, at this point, we're sending people home with 8 oxycodone pills, and I tell everyone not to take them. I tell everyone to flush them down the toilet. Honestly, within a matter of a few days, most people don't need any kind of pain medicine afterwards, which is phenomenal change. The patient I told you about, who had her surgery 25 years ago, she's got an incision from stem to stern to have her bypass done. That's a week in the hospital. It's hernias and stuff we've been able to cut down so much on the long-term complication rates just with improvements in technique. We've been doing gastric bypass since the 1970s. We're a whole lot better at it now than we were then. A whole lot better at it now.
My mom actually had the hers, and she was cut that far.
Had it done open.
And she still has the scars. She
Yeah.
almost talked me out of having the surgery. But I'm almost a year out. Right before my birthday, I'll be a year. I talked to her a couple times. She told me that I needed to be sure about the surgery. And she told me that 2 people that she's related to had the surgery. They both had mental health issues, and one ended up dying in a car accident, and the other one killed herself. They lost all the weight. They looked really great, but they ended up dying. But my biggest motivator was my sister Sherry, and she's been there since day one. Unfortunately, I have had a lot of stressors.
How much stressors though? After her surgery, I got really, really sick. Really sick, and I had to be put in the hospital and almost died.
Goodness.
Because I got a bad lung infection from my job. So I'm her stressor.
You're the source, yeah.
I'm the source, but I'm also her biggest motivator. I'm her biggest supporter.
Yeah.
I tell her every day, she can do it, just breathe. It's one step at a time. It's not a rat race. You ain't got to try to just
Yeah, you don't lose it all in one day. That's right.
one foot in front of the other. You ain't got to run for it.
Well, I'm glad you lived to tell the tale and you lived to be her support and her motivation. Having the support of family and friends is so important in this. I've seen it go both ways. I've seen people who keep it a secret from their family, or they're embarrassed to tell their family or their friends, and it just never goes the way you want it to, when that's the case. I think having the support of the people close to you in your life is so critical to success after this. Lean on people,
And this support group, I think, is one of the things that has been motivating to me too, to be with folks who've had the surgery and facing
Yeah.
the same things. So I think that's really.
You're definitely not alone. Nobody, you're not going through this alone.
Dr. White, I have a
Yes,
question.
sir.
You referenced a patient earlier, they had put the weight back on.
Yes, sir.
And then took it off again. Was that just changing their eating habits and diet, or did it require second surgery?
She had no. She did not have a second surgery.
Okay.
No, nope. She did not. She did not do that. I don't even think she went on medications afterwards. She went through I think an ugly divorce and then lost a child. And you know and this doesn't happen overnight. I mean, it was a matter of a few years, and just like we talked about, you know, like I mean, life is going to continue to happen, and how you respond to it. It's never too late. It is never too late to turn it back around.
I do have something to say about the anxiety. I was actually in a bad car wreck, and from that had PTSD and anxiety. And I feel that the pressure you put on yourself, or in my situation, it makes your anxiety worse because you put the pressure on yourself to lose it and not fail. And the anxiety of every time you get on a scale or you come away, it can be worse, but you kind of.
What do I tell you about getting on the scale at home?
You tell me to throw away.
Throw it out or hide it from yourself.
The
Yeah.
pressure you put on yourself to lose the weight can make your anxiety a little bit worse.
I agree.
Like, we do it to yourself. It's not from the surgery. It's
Yeah.
from here what we're trying.
And looking at the number on the scale every morning makes it 1,000 times
And
worse too.
From that wreck, I had hurt my back, and I was getting injections in my back every quick as you could get them. I think you could get like 3 or 4 a year. And the first day that I ever met him, I had just had an injection. And
You were
I
laying
was-
down flat on the bed.
was
I
laying
remember
on the
it
table
plain
in
as
so
day.
much pain
Yeah.
and almost tears the first day I met him. And I haven't had a back injection since surgery. And I'm on no medicine, no pills for the pain. It's gone.
So good. You kind of contest to something like that, because I used to have sciatic nerve pain, and it would pinch, and that was, I worked in the kitchen, carpet floor, everything, and then, you know, I just gained a whole lot of weight after I graduated from high school, and it just never got any better, so I can definitely say after my surgery, there's no more pain in my back at all.
The back doctors actually released me.
That's
That's
what I'm
awesome.
looking forward to, because we have our surgery
Yeah.
next month, and I've had 2 back surgeries already.
Well,
I'm
it
hoping
has,
no
I
more.
completely, I can, it's amazing to sit there and not hurt.
Yeah.
And
Looking forward to
again,
that.
I'm not even on, I don't even have to take Tylenol for it anymore. I'm on nothing.
About the big dollars.
I had,
Back, knees, hips, we see it all.
Yes.
And
It's amazing what
it's
letting go of,
amazing
you know,
what-
carrying around an adult human alongside your extra, you know, your weight will do for all your joints that bear all that weight. Oh yeah.
Is there anything, Dr. White, you'd like people to know in preparation for surgery that would help you as a surgeon?
Mm.
Like, wow, I wish the patients would do this, or
So you don't have lung problems or, you know, something that comes up?
Lung problems?
Yeah, I mean, so that we don't get sick afterwards or?
I don't know. I don't want people to think too much and overthink this. You know, I think people get themselves kind of spun up into a tizzy about everything. You know, because this is a huge life change for people, but take it one day at a time. You know, I try to put people at ease. I want people to be relaxed. You know, like don't get too stressed. Don't get too bent out of shape about it. It's just a surgery. You know, it's one day, and you're going to be in and out of the hospital in no time. And
and
you know,
the
like.
only regret I ever had was not doing it sooner. I promise, it will change your life. It will.
Yeah. I struggle finding reasons to not do these operations on people. I mean, no matter what shape people come to us in, whether they've got, you know, they've had heart attacks. I've done weight loss surgeries on people who have LVADs, which is a thing that pumps your heart for you, to try to like bridge people to getting heart transplants. I mean, you can be literally tied to the wall, you know, like in hospitals, and you're still going to benefit from having these operations, you know. So no matter what shape people come to us in, just come and do this. This is a gift that you can give yourself. It's a gift you can give your future self, you know, and it requires an investment. It requires time and money and effort, but what better way to spend, you know, your time and your treasure than to invest in yourself and your health and be there for your family. I don't know. I'll think about what I want to tell people, what I want the closing message to be. Mostly it's just to relax. Just relax. Surgery's going to be fine. Like, leave that to me. We got it. We're good at this now. Like, surgery goes fine.
Well, thank you so much, Dr. White. Does anybody have any other questions as we kind of wrap up, or going into the last thing I'll say is they really do, like, I'm a worrier too, for all of y'all that haven't had surgery yet, but being on the clinic side and not in the operation room, when I did go in the OR, it was pretty amazing to see. I know they see it all day, every day, but from the clinic side, when we go in, it is amazing how organized and to a T and relaxed they are doing your surgery. I mean, it is.
We're listening to tunes and singing and cutting up. Yeah.
Listen to
the
music.
OR is our happy place, right?
You know,
clinic is something that surgeons have to do to be able to operate. You know? So yeah, the OR is the fun part. That's for us at least.
So it is quite amazing to see them doing what they're doing, you know, and they have it down to a T. So if that eases your mind at all from a non-clinical person, to say like they know what they're doing, and the nurses and staff down there are absolutely amazing.
We have an incredible team of people in the OR here. Unbelievable help.
Well, thank y'all for coming, and if you have any questions for me or Jenny or Dr. White, please let us know as we kind of wrap things up. Okay.
And also next month is our Christmas party. So it's a little bit more informal. We'll have like small kind of healthy snacks, you know, if you've come in years past, and the surgeons will be there and they'll be invited. I'm not sure if they'll all be there, but some other staff members will be there, and it's just kind of a fun time, you know, celebrate the year.
That will be on the 3rd?
Yes. The first Tuesday of the month. And it'll be on Facebook and Instagram and stuff like that too.
Yeah.
But yeah. Thank y'all.
Thanks for coming.
Thank you very much.
I'm a little bit more relaxed.
Okay.